What if your kidneys were silently failing and you didn't even know it? Chronic kidney disease affects millions, yet most people don't realize the danger until it's too late. Let's uncover the truth about chronic kidney disease and how you can protect your health before it's too late. Your kidneys are like the quiet multitaskers of your body, filtering waste, balancing fluids, regulating blood pressure, and keeping everything in check. You probably don't give them a second thought unless something goes wrong, and by then, it might be too late. With over 100 million of the global population affected by chronic kidney disease, CKD, kidney failure is no joke. Approximately 500,000 people die each year in the United States alone from kidney failure, a late stage of chronic kidney disease. The tricky part is that the early signs of kidney failure are often subtle or easily overlooked. That headache? Maybe it's just dehydration. Swollen ankles? Must be a long day at work. Fatigue? Probably stayed up too late binge-watching your favorite series again. But what if your body is trying to tell you something much more serious? The earlier you catch signs of kidney trouble, the better your chances of avoiding full-blown kidney failure. In this video, we'll look at 10 telltale signs that your kidneys may be on the decline, backed by scientific research. Let's dive into these kidney SOS signals so you can catch them before it's too late. If you find this video healthy and informative, don't forget to subscribe and hit that bell. We bring you the best of health and wellness, supported by the latest medical studies and expert advice. Together, let's make health accessible to everyone. 1. Fatigue and weakness. We all get tired from time to time, but if you find yourself feeling unusually exhausted despite a good night's sleep, your kidneys might be struggling. When your kidneys fail, they can't filter out toxins and waste products effectively, causing a buildup in your bloodstream. This makes you feel sluggish and weak, like someone hit the slow motion button on your energy levels. A study published in the American Journal of Kidney Diseases, 2017, titled Fatigue and Kidney Dysfunction, a clinical study, revealed that chronic fatigue is often one of the first signs of kidney failure. Your kidneys help produce a hormone called erythropoietin, EPO, which signals your body to make red blood cells. When your kidneys aren't working properly, EPO production drops, leading to anemia, and you guessed it, fatigue. So, if you feel like you're dragging all the time, even after your third cup of coffee, it might not be your work schedule, but your kidneys calling for help. 2. Swollen feet and ankles. Had a long day at work, and now your feet and ankles are swollen like balloons? Sure, it could be due to standing for hours or sitting at your desk too long, but chronic swelling could also be a sign that your kidneys are failing. When your kidneys aren't able to remove excess sodium and fluids, they start to build up in your body, leading to swelling, particularly in your lower extremities. A study in the Clinical Journal of the American Society of Nephrology, 2016, titled Peripheral Edema and Chronic Kidney Disease, found that peripheral edema, swelling in the feet, ankles, and hands, is a common symptom of kidney failure. If this swelling sticks around even after some rest or elevation, it's time to pay attention. Your kidneys might be waving the red flag, telling you they're struggling to keep up. 3. Changes in urination. Let's be honest, we don't usually spend a lot of time thinking about our bathroom habits. But if you notice any unusual changes in your urination patterns, your kidneys might be in trouble. Increased frequency, especially at night, or a noticeable decrease in the amount of urine you're producing, can be early signs of kidney failure. And if your urine is foamy or bubbly, that could indicate excess protein in your urine, a condition known as proteinuria, which is a hallmark of kidney dysfunction. A study published in Nephrology, 2018, titled Urinary Changes and Early Detection of Kidney Disease, found that changes in urination habits are one of the earliest warning signs of kidney trouble. So, if you're suddenly visiting the bathroom more or less often, or your urine looks suspiciously different, it's time to check in with your doctor. 4. Shortness of breath. Feeling out of breath after climbing a single flight of stairs? While this could easily be attributed to being out of shape, we've all been there, it could also be a sign that your kidneys aren't filtering out enough fluid, causing it to build up in your lungs. Kidney failure can lead to a condition called pulmonary edema, where excess fluid accumulates in the lungs, making it difficult to breathe. According to a study in the American Journal of Respiratory and Critical Care Medicine, 2017, titled Pulmonary Edema and Kidney Failure, a Clinical Study, shortness of breath can be a direct result of kidney dysfunction. So, before you blame your cardio routine, consider whether your kidneys are silently asking for attention. If you're gasping for air after minimal exertion, it might be time to get things checked out. 5. Persistent itching. If you're constantly scratching your skin as if you've been rolling around in a patch of poison ivy, your kidneys might be to blame. When your kidneys aren't filtering out toxins efficiently, they start to accumulate in the blood, causing intense itching. This condition is known as uremic pruritus, and it's a common symptom of advanced kidney disease. A study in the Journal of Nephrology, 2019, titled Uremic Pruritus and Kidney Disease, a Population Study, found that over 50% of patients with chronic kidney disease experience persistent itching. This isn't your average dry skin. It's a deep, uncomfortable itch that lotions won't relieve. If you're scratching nonstop and can't seem to find relief, your kidneys may be sounding the alarm. 6. Metallic taste in your mouth. Ever notice a strange metallic taste lingering in your mouth? It's not because you ate something funky. It could be a sign that your kidneys aren't doing their job. When waste products build up in the bloodstream due to kidney dysfunction, they can affect your sense of taste, making food taste weird or causing a constant metallic taste in your mouth. This is known as uremia, and it's a common symptom of kidney failure. According to a study in the American Journal of Clinical Nutrition, 2018, titled Uremia and Taste Changes in Kidney Disease Patients, patients with kidney failure often report a metallic taste or even a loss of appetite. If your favorite foods suddenly taste off or you're skipping meals because of this unpleasant taste, your kidneys may be trying to tell you something. 7. Nausea and vomiting. Feeling queasy or throwing up more often than you should? This could be another sign that your kidneys are failing. When toxins and waste products accumulate in your bloodstream due to kidney dysfunction, they can cause digestive issues like nausea and vomiting. This is another side effect of uremia, which wreaks havoc on your body when your kidneys aren't doing their job properly. A study published in the Journal of Gastroenterology and Hepatology, 2017, titled Gastrointestinal Symptoms and Chronic Kidney Disease, found that gastrointestinal symptoms, including nausea and vomiting, are common in patients with kidney failure. If you're feeling nauseous without any apparent reason, and no, it's not from that questionable takeout you had, your kidneys might be the culprit. 8. High blood pressure. High blood pressure is both a cause and a consequence of kidney failure. When your kidneys aren't functioning properly, they can't regulate blood pressure as effectively, leading to hypertension. On the flip side, high blood pressure can damage the blood vessels in your kidneys, further reducing their ability to filter blood and manage fluids. A study published in The Lancet, 2019, titled Hypertension and Kidney Failure, a Bidirectional Relationship, revealed that hypertension and kidney disease often go hand in hand, with patients experiencing worsening kidney function as their blood pressure remains uncontrolled. If you've been battling high blood pressure and nothing seems to help, it's worth investigating whether your kidneys are part of the problem. 9. Pain in the lower back. Kidney pain typically presents itself as a dull ache or sharp pain in your lower back, usually on one side. If you're experiencing this kind of pain, especially if it's persistent or accompanied by other symptoms like fever or nausea, it could be a sign that your kidneys are in trouble. Kidney stones, infections, or even kidney failure can cause this type of discomfort. According to a study in the British Journal of Pain, 2018, titled Lower Back Pain and Kidney Dysfunction, a Clinical Overview, patients with kidney issues often report lower back pain as one of their earliest symptoms. If your back is giving you grief and you can't pinpoint another cause, it might be time to get your kidneys checked out. 10. Feeling cold. All the time. If you're bundled up in sweaters while everyone else is wearing t-shirts, it might not just be a case of feeling the cold more than others. When your kidneys aren't filtering your blood properly, it can lead to anemia, a lack of red blood cells, which makes it harder for your body to stay warm. Feeling cold all the time, even in warm environments, is a common symptom of anemia linked to kidney failure. A study in the Journal of Renal Nutrition, 2017, titled Chronic Anemia and Cold Sensitivity in Kidney Disease, found that kidney failure often leads to chronic anemia, making patients feel cold and fatigued. So if you're shivering in what feels like a normal temperature, your kidneys might be waving the white flag. Your kidneys are incredibly important to your overall health, and when they start to fail, your body will send you signals. Sometimes subtle, sometimes not so much. From fatigue and changes in urination to swelling and persistent itching, these signs are your body's way of asking for help. Ignoring these symptoms could lead to irreversible kidney damage, so it's crucial to pay attention and get medical advice if you notice any of these red flags. The earlier you catch kidney problems, the better your chances of managing them and avoiding more serious issues like kidney failure. Remember, your kidneys do a lot for you, so make sure you're keeping an eye out for them. After all, they deserve some TLC too.